The biggest challenge,
What the fuck is this?
first year of dentistry.
We have to create a very good connection with the patient.
Smile Cloud.
Form, design, shape. We can talk a lot, but the patient cannot see this.
In which clinical situation?
I start to work with stone and wax.
Back to the beginning.
Soccer player, tennis player, rock star.
Key opinion leader at Tokuyama.
Newton Fal, Professor Baratieri, Giorgio Manalta
How you understand
is here. Cross section.
What is your hobby?
To spend time with my son. That's the most important thing in my life. We work a lot, we're traveling a lot, it's not easy.
Favorite tennis player?
Now we have a problem.
Hello everyone, welcome to another episode podcast here at Dental Simulation. Today we have a special guest. Welcome Thiago Ottoboni.
Thank you, my friend.
Thank you to accept the invitation to be here at Dental Simulation as a lecturer, and thank you to accept to make a podcast with you.
It's a pleasure, it's a big pleasure to be here. Always a pleasure to come to Romania. It's a country that I have a very good connection, very good relation, you know. And so I'm very happy to be here with you in this special moment.
Thank you so much. We will start with the beginning. When you realize the passion at the dentistry?
I start many years ago in a small city when I finished my graduation, and then I moved to Blumenau. It's the south of Brazil. It's a very nice city too. And then I start my career there, taking care of patients. I start my own office to work there. And always my focus, it was work with restorative dentistry. So I tried to find a very good course to do my first post-graduation in restorative with a very good mentor, Walter Scalco. And when I finish this course, it will be very special for me. It was very special for me. I start to work more with focus in restorative, and then I met some friends that I can talk after, and then I have a very good game changer in my career. But in daily practice, for me, it's very special to maintain a good connection with the patient and try to solve the problems that the patient has.
What was the biggest challenge in your first year of dentistry?
I had the trust of the patient because I start very young, and sometimes the patients arrive at my clinic, and when the patient enters in my clinic, okay, you are very young, so where's the dentist? And no, it's me. No, it's not possible. So it's not a joke. This has happened, but for the first year, it's very difficult for us to start because we have to create a very good connection with the patient, as I told, and try to show that we are young, but we studied a lot, and we want to do a very high level quality of treatment for the patient. So show this for the patient in the first year was very difficult for me to show for the patient that I want a lot, that I can do this and do this. So this for me was very difficult.
Who influenced you most professional? Maybe you have like a mentor?
Yes, I think that a mentor can change everything in your life. And when I finished this post-graduation in restorative dentistry with Walter Scalco, I went in a very special congress in Brazil from Professor Baratieri. The name is Revista Clínica. And there I met Victor Clavijo. And that time I met Victor. We had very nice moments together to talk, and Victor starts to be for me a mentor after the Congress as for the longer my career. So Victor showed for me the problems in my work and how I can grow up. For example, showing for me the way that I can follow, for example. So this for me it was very special. All the time when I remember this, it's very very special for me because Vitor changed my career.
When you have a first consultation in your clinic, how you make the first consultation?
The first consultation for me it's one of the most important, because if we don't do a very good first consultation, we cannot do the second. So this first approach is very important. So we have to organize the clinic to receive this patient, and the same time that we put the schedule for him, I try to spend very good moments with him, and do what I do. Show for him that I'm thinking about he, to listen more than speak. So I can listen a lot what the patient wants to change or wants to do, and organize ideas, taking photographies, doing scan, thinking about X-ray, for example, asking for CBCTs, organizing a very good clinical examination for him. And all the focus is listen more than speak. And then I put everything, the informations inside of this Smile Cloud, and I can connect with my team to organize the plan for this patient. And then we can show in the second visit for him what we are planning. And sometimes it's okay, sometimes we can change a little bit with the expectations for the patient. And we can do this with a very good first visit and then second visit.
Okay, and at the second visit, you present the treatment plan to him.
Yes, yes, because in the second visit we have the exams, for example, the CBCT, the X-rays. We have already the informations inside of the Smile Cloud. I always create, if it's necessary, the smile design and the video for to show for the patient the intuitive that we are want to do, and we can connect with the patient, organize the ideas together, because I always talk with the patients, we are like a team. I want to do the best for him, and he can help me to understand what he wants, for us together create a better treatment planning for him and better treatment for him.
And you make the plan in Smile Cloud, or you have some dental technicians?
No, I always create the smile design for all the patients, and when the case it's about resin, composite resin, I present for the patient. When the patient accept this, I finish the blueprint doing the 3D WhatsApp to do along my composites. But when I need to work with ceramic, and I work a lot with ceramics too, I create a smile design, I present for my patient, and then I invite my dental technician for the case, for him connect with me and the patient, and then he finish the 3D WhatsApp, because he will do the ceramics.
Okay.
Yeah. So I have this workflow at the clinic.
What about Smile Cloud? When you start to work in Smile Cloud, how it's changed Smile Cloud your life?
Yeah. Smile Cloud is very special for me because uh, Florin and Eric Van Duren is the other mentors for me, and I met him long time ago. And when Florin shows for us the Smile Cloud in 2018, 19, for me it was a very special, because in my mind I needed this, but when Florin showed for us, I think in my mind, sorry for the words, but what the fuck is this? Because now I can connect all the team together. I can organize the informations together. I can see everything in the same screen, and I can talk with my patients with very, very high quality information. Because without this, we can talk a lot, but the patient cannot see this. And now I can show for my patient, I can invite my ortho, I can invite my prosto, my surgeon, and we can connect and work together in the same place, but in different countries working together in the same place. So it's like a very powerful that we have using the Smile Cloud. And for me, it's very special to be here talking about this because there is Romanian software. So this is very, very special for me.
How it's important in nowadays the interdisciplinary dentistry.
Interdisciplinary dentistry for me is all, because all the treatment we have to understand about the other disciplines. So all the patients that came to my clinic, we try to organize together with the team, all the patients. And then we can show for the patient what he needs to do. Sometimes what he needs to do is not the same that he wants to do. So we have to organize these different informations and try to organize one good treatment plan for him. So we always need to open our minds to accept the new informations, the new tools to grow up together in restorative dentistry, in surgeon, in ortho, in perio, and another disciplines. So interdisciplinary dentistry, it's very, very important.
What is, in your opinion, most important fitness in anterior restoration? It's like functional, aesthetics, or all together?
In my opinion, form, design, shape is more important, because shape can guide for us reflection and can guide for us occlusion. So shape can show for us the color and the function, and this is very important. The color is the second step. If I create a very special layer with a high quality color and made a mistake in the shape, the patient will see. But if I create a very special shape of the restoration and made a very delicate mistake in the color, the patient cannot see this. So for me, the shape is the first, because can create a very high quality design for the patient, very high quality reflection of the light, and creating a good shape, we have a very good occlusion and very good disocclusion for the patient. So for me, the shape is important. Obviously, color is important too. We are talking tomorrow about this at the course, but we have to understand both, but shape is the first.
But about the layers, what is your protocol?
About the layers, I think that's very nice to understand the complexity of the layering technique. For each case, you change a little bit. For this case, trying to simplificate the layering technique. So sometimes we have to layer one case using opacers and then denting layer and then a lot of stains and then effects in the incisal head and then finishing with a very delicate layer to cover everything with two composites. It's nice, but sometimes we have to understand that one color, maybe one body shade, we can solve the problem and more faster and more predictable. So we have to understand the complexity to try to do minimalist in restorative dentistry.
Okay.
And this is important, sorry, when we think about thickness. That's the reason that we work a lot with the, for example, with the Smile Cloud, because we can plan using the software, we can cross-section, and we can measure how much space we have to work for each tooth in the same case, and then we can plan if we have to put more or less dentin for this to balance the color of the shape and balance the color, the shape, and the volume before the final layer. So this is important for us because when I begin, I start to work with stone and wax. And it's nice waxing, but it's not possible to see inside of the wax and the stone. And nowadays, with the technology, we can see all together in the same time. With 2 clicks, we can measure everything. So for me, this is very nice for us nowadays to start to work with this technology.
Yeah, sure. And after this, also it's important the finishing of a restoration.
Yes.
What about
The
this?
finishing polishing,
Yes.
it's very very important for us. We talk about the students that you spend sometimes you spend a lot of time to layer and then you want to do the finishing and polishing very fast. It is not so good. I have to spend a lot of time to layer, but I have to create a break for the patient, for us, and then we restart like a new to spend time to finishing and layer. Because when we finish very well, for example, in veneers in the cervical area, we can create a very delicate emergence profile and very polishing surface. And doing this, we can create a very good quality of the connection with the soft tissue, with enamel and resin. So this is most important, not only for the polishing and brightness, but for the health of the patient. The finishing and polishing is very important, yes, for the aesthetics, but more important too for the health, for us to understand how the soft tissue will connect with this composite area.
Okay. In in which clinical situation uh, you choose indirect restoration or direct restoration?
When I have space, is a good question. When I have space to layer directly, it's nice. When I have space to work indirectly, it's nice. But I need to understand when I work with direct composite, I need to see if I have space to work. Only this. If I want to work with indirect composite, I need to understand if I have space and path of insertion. So if I have these 2 points, I can go indirect. And for me, it's nice technique because it's possible to polish the veneer, for example, in my hand, and it's possible to polish the interproximal area better. But sometimes I have space, but I don't have a path of insertion. And in my opinion, if I have to prep a tooth to do a composite, I prefer to do with ceramic. So my decision is if I want to work indirect with composite, I have to check if I have volume, space, and path of insertion. If I have this, it's very nice to do. And we have, for example, a very special professor from Brazil, Newton Fal, has an amazing technique, is direct, indirect technique, that he create the veneer, for example, in the tooth, and then he remove, polish, finish and polish, and then bond. So this is very, very nice technique too.
Yes, but in big case, for example, for mouth reconstruction, how you planning, how you understand where it's need to make ceramic, for example, restoration or direct restoration?
It's a good question. If I starting to work maybe in a very young patient,
Okay.
I try to be more conservative and I try to work only adding material. So in these young patients, first rehabilitations, I try to go to resin because it's more easy to add. I can inject, I can preheat and press, I can do indirect and bond without preparations. If I'm working in a older patient that has more veneers and it's not the first approach, I go direct to do ceramic. I prefer. If this patient has implants too, I prefer go to ceramics. So my idea is like this. In first visit, in first approach, young patients, I try to do with composites, and older patients with a lot of ceramics or implants together, I prefer to go to ceramic.
Let's go back to the beginning. How did you realize you have a passion for dentistry?
I was born in a very small city in Brazil. The name of city is Veracruz. We have 8,000 persons there. It's very special city. I have there my family too, yet, and I grew up there very with a very special uh, life, simple but very special, with a good connection with friends, walking along off the streets, playing soccer, playing a lot of tennis too. That's my passion, to play tennis, and with a good connection with my family. And then when I growing up, the first idea in my mind, it was to be a soccer player and then a tennis player and then a rock star. And then I start my first rock and roll band with 14 years. And the idea it was my rock and roll band grow up a lot for me to put a lot of tattoos. And then the rock and roll band is not so good. It's good. It was good, but we can not explode, for example, and then I become a dentist. And to finish my dream, very good. I'm a dentist. I'm very happy with this, and I put a lot of tattoos, and now I'm completely happy with this.
I see you have a tattoo with Smile Cloud.
Yes, it's
What
here.
about this?
Yes, I have a tattoo of Smile Cloud because Smile Cloud for me is not only a software, it's like a family, and it's like a very connection, a good connection with a Brazilian family and Romanian family. And nowadays we have very special connections. We have almost 10 years working together, talking every day about things. So I did this tattoo to to put more stronger in my skin these special moments.
And when you have time, some free time, what is your hobby?
The first thing when I have time, it's to spend time with my son. That's the most important thing in my life. I love him. He's very special, and we work a lot. We're traveling a lot. It's not easy to leave him. Uh, so when I have time, I try to spend time with him, with a good quality of time with him, and go to the club to play tennis with him. Sometimes we go to the stadium to see soccer matches, and he loves Corinthians. It's a very special team from São Paulo, and we can go together and enjoy very special moments with him and my girlfriend and my family.
What is your favorite tennis player?
Now we have a problem. Yeah, because my favorite tennis player is Nadal, Rafael Nadal, and but Gustavo Kirten from Brazil, it's unbelievable and special for us in Brazil. And now we have a very young talent in Brazil. The name is João Fonseca. He's very strong, very aggressive, have a very good mind. So we are very happy in Brazil nowadays to have João, and maybe João can get for us a lot of titles and good moments. But Nadal, it's special. Yeah.
How do you approach repairs instead of restoration, for example?
Reparation when we
Yes,
have problems.
yes.
It's nice question because we have to understand uh, what problem we have. For example, if I have a fracture in a composite because the patient have an accident, it's one thing. But if I have a fracture because the occlusion is not so good, I need first to understand what is going, and then I can repair. The step by step is very easy. We can put a burr, create the bevel, for example. It's very important to sandblast. And I know here we have a cocker to sandblast the surface very well. We can create and increase better adhesion for this. When we sandblast, we can put phosphoric acid, rinse and dry, and then we put adhesive system and composite resin. And then I finish and polish very well. So the first thing is understand uh, what we had the problem. So this is maybe the first tip. Understand if it's a accident or the problem it was created by a problem in the this occlusion. Yeah, yeah.
In our day, we have a lot of courses about layering, about anterior restoration, and we have a lot of books about this.
Yes.
What is your recommendation to young dentistry, which they need to understand which is better, to
Good.
work more or to read more about this?
Both, but try to follow good mentors. Good mentors is good person and first, and good clinicians, professors that work and has clinics too, not like only professors doing a lot of courses and don't have your own office, don't work day by day in daily practice, because in daily practice we have a lot of problems, a lot of problems, and these mentors can show for you the reality of the profession. The profession is very hard, but is very, very good and special. So you have to understand this. The Instagram is very nice, but the Instagram always is perfect and blah, blah, blah. So follow good mentors to follow, and maybe your career will be changed like Victor and another mentors changed my career.
Okay. What is your recommendation for young dentistry, the best free books about restoration?
About restorations, the book from Newton Fau, it's amazing. We have books from Professor Baratieri about composites. It's very, very special. And we have a lot of books here in Europe, for example, Layers from Giorgio Manalta and Angelo and Walter from Style Italian is very nice too. So we have 3 books. We have more books important, but these 3 books is very, very special. If we talk about the interdisciplinary dentistry, we have an amazing book from Florin and Eric Van Duren and Guto Giordani, Victor Clavijo, and Vincent Stankov talking about interdisciplinary dentistry. This book is unbelievable.
How you manage your time in your life, professional life and your private life?
I'm trying to balance this. 10 years I started to try to balance this and I didn't finish, but I'm trying to balance. This is not easy because we love to work. We love more our family, obviously, but sometimes if we think about the timeline, sometimes in your life you have to work more for the future. You have more time, but you have to understand this because sometimes you work a lot, and then when you finish, you don't have more time, or maybe you don't have health. So I'm trying to balance this for this the uh, for the next years, to get more time with my son, with my family, and balance more time with my career, because nowadays I spend a lot of times in my clinic, and maybe 3 times for a week, and then another two times days I go to travel and lecture and courses, and I spend more time in a weekend with my family. Obviously, my son lives with me during the week, but he goes to school, I'm go to work, and we can get together only at night. So I try to balance this for the future, maybe have more time during the week, but on the weekends.
Okay.
Yeah.
What about the courses? When you start to make the courses, how was the way to the big international
I
lecturer?
now I'm started courses in 2014. I was doing a course with Victor Clavijo. I was a student from Victor, and my professor, Walter Scalco, invited me to help he in his course. And I accepted. It was very special for me because uh, I saw the way that Walter organized everything, the models, the materials, the relation with the students. And when I was there, I can learn a lot about this. And Victor showing for me a lot of different ideas. And in 2014, I received the invitation from a school in Balneário Camboriú. Is a very nice city, very close to my city, to do my first course. It was very special. I did a course, a 3 days course about composite resin in anterior and posterior, and then I start to do this all my life.
Okay. How did you become a key opinion leader at Tokuyama?
When I was in a graduation, I did a fellow with a professor, Anselmo Mariotto, and Roque Mérida. And Anselmo using at that time used a lot of Tokuyama. I'm talking about it 2003, 2004, many years ago. And that time I saw the brightness and the polished surface that he did working with the Tokuyama composites. When I finished my graduation and opened my clinic in Blumenau, I always think about quality. So I tried to use the best materials. So that time I found in Brazil some dental companies that sell Tokuyama composites, and I found the name was Stellite Sigma Quick. Now in Brazil the name changed for Palfic LX5, but it's the same composite. And I start to use since the beginning. So when Tokuyama starts in Brazil, I already had cases with follow up with 7, 8 years. So that time I start the relation with Tokuyama in Brazil with a very special dealer in Brazil is PHS. It's a very big company that create and have a very nice factory creating bleaching agents. So it's very high quality. And this company the import and distribute Tokuyama in Brazil too.
Okay. What was your decision to open your clinic in Brazil?
When I moved to Blumenau, I start to work in in a office. Okay, it's not my office; it's a friend office. In 2008, and that time in November or October, I didn't remember. Maybe November, we had a lot of rain, and we have the rivers go, and then we have a very a big, difficult situation in Brazil and in my city, in Blumenau, with water, and the guy lose the clinic. And that time I rent one space and I moved with this guy to build a very simple office to start to work 1 month after. So my family helped us to do this, and we organized this very, very fast to start to work again, because the city was flooded totally. It was very terrible.
And after this, you grew up and opened Thiago
Yes,
Ottoboni,
yes. And then,
Ottoboni
yes,
Clinic.
yes. 13 years old after, we built the new clinic. The name is Design Ottoboni. It's nice clinic with my brother Gustavo.
Congratulations.
Thank you.
And when you make some decision to open the clinic, how you plan the clinic? How you was the decision?
The decision was a dream with me and my brother Gustavo Ottoboni. And that time we are thinking about, for example, okay, let's build this, but this needs to be our face, you know. So we try to found architecture to create this. And one time I'm having a dinner with a friend, and I was spoken about that I was looking for architecture, and the guy, this friend, told me, okay, in that table in the same restaurant, we have maybe one of the best architecture in Santa Catarina in Brazil. The name is Nicolas Alencar. And then that time, this guy invited he to the table, and we met. And then Nicolas create the project. And when Nicolas present for me and my brother, when he finished, I start to cry a lot, and my brother start to cry a lot. And then Nicolas built this clinic. He's very special architecture and create for us that we always dream. He created for us unbelievable clinic like you have here.
Okay, what will learn dentists for tomorrow here at Dental Simulation?
Let's layer a lot of techniques with amazing composites. Let's talk about the planning with the Smile Cloud. We will use a lot of the microscopes that we have here, and this dental simulation is amazing because we have all the materials in the perfect position to work, and the students can have the perfect simulation that we have in the private practice. So it's amazing space for us as a lecturer to came to work, because we can see how much details we have here, for me, for the other professors, but for the students with high quality. Everything here is in high quality. Congratulations, my dear.
Thank you
It's
so
a
much.
pleasure to be here.
If you would meet yourself at 18 years, what would be your advice?
Practice more tennis. No. It's a joke. Maybe maybe I try to do the same. Always in my life, I try to do the things with heart. Okay, because I learned this with my mother and my father. And always I make decisions. Some decisions I did with my heart, I had the problems, but most part, following my heart, I had a good decisions with good consequence. So maybe I didn't change nothing. I'm happy.
Oh, very good. Okay, we'll ask you final quick questions, okay? Composite or ceramic?
Composite.
How do you choose?
It's like a philosophy. We spoke about this a few minutes ago. To choose composite, I think maybe in partial restorations, for young treatments, first approach treatments. Ceramic when I have old patients, maybe patients that cannot clean very well, maybe patients that have a lot of problems with bruxisms, for example, and not so young patients.
Digital planning or analog planning?
Nowadays, digital planning.
But you made it
I started doing analog way, using wax and stone and waxing 10 years in my career. This is very important for us, but I can understand nowadays that when I planning in a computer, because in the beginning, when I start to work with waxing, it's very good because I can see the lines, the margin, crystal margin, the shape. It's possible to practice. And when I start to work with digital, that time the idea is okay, maybe I will lose these information, but not. When I work in digital, for example, waxing in the Smile Cloud, I can see the shape, I can see the emergence profile, I can see the planes of the tooth, the angles, everything. So when I'm planning, I'm feeling the shape. So it's possible to understand this for us after this layer, for example, the composite.
The biggest mistake in shade selection?
Biggest mistake in shade selection is don't do this when the patient arrive at the clinic. Sometimes I can see at the post-graduation course, the student talk a lot with the patient and then put the lips expander for the patient, and then take the instrument, take the composite with the air conditioner there, and the natural tooth will be dehydrated. So the first thing that we have to do is put the bottom and polymerize, and you can see the real situation with the natural tooth.
One material or instrument you cannot work without?
One material is white enamel color from Tokuyama. It's amazing. It's amazing.
One tip for achieving more natural anterior restoration?
Try to balance the dentin layer and use some stains to create the deep effects before the final layer. Maybe you using this, you can create more natural restoration, because most part of the time we don't have a lot of space to layer a lot of layers. So using some stains, and nowadays the stains, for example, from Stellite color, we have a very natural color. You can create a very nice color for the final restoration.
How do you see the future of aesthetic restorative dentistry?
More predictable, more faster, and maybe working with more guides in resto, because we can plan very well. We can print different models, so we can create guides with transparent silicone and guide the layers. I think maybe this is the future.
Thank you so much for this
Pleasure.
productive podcast, and we'll see tomorrow at the course.
Yes.
Thank you.
Thank you, my friend.
Thank you so much.